ISO 13485 2016 training. Hello everyone, welcome to this comprehensive session on ISO 13485 2016 training. In this video, we will cover the foundation, internal auditor and lead auditor concepts of the standard. Whether you are quality professional, auditor or someone who is new to medical device quality management systems, this session will give you a complete understanding of the standard, audit practices, and best compliance strategies. By the end of this video, you will know exactly what ISO 13485 is, how it works, and how to implement it efficiently in your organization. So, without further delay, let us begin with an overview of ISO 13485 2016. Overview of ISO 13485. ISO 13485 2016 is an internationally recognized standard for quality management systems in medical devices. It provides organizations with a framework to ensure consistent quality, regulatory compliance, and patient safety. Its 2016 revision emphasizes three key points. First, a risk-based approach to quality management. Second, strong documentation and record control. Third, effective internal and external auditing processes. Why is it important? It ensures that medical devices are manufactured consistently and safely. It helps organizations meet regulatory requirements worldwide. It builds trust with customers and regulatory authorities. Example, imagine a medical device company producing surgical instruments. ISO 13485 ensures that every instrument is traceable, meets safety standards, and complies with regulations. Some key features of ISO 13485 include focus on quality and safety, patient safety, structure, documented processes, requirements for internal audits and management review, alignment with regulatory compliance worldwide. Now that we understand the overview, let us move to foundation training concepts. Foundation training. The foundation training covers the basics of ISO 13485. It is ideal for beginners or professionals who want a clear understanding of the standard. Topics covered in foundation training. First, structure of ISO 13485. Clauses and sections of the standard. Scope and applicability. Second, quality management principles, customer focus, leadership, process approach, continuous improvement. Third, documentation requirements, quality manual, procedures, records, traceability and document control. Fourth, risk management, risk-based thinking, risk assessment and mitigation. Fifth, regulatory compliance, alignment with national and international medical device regulations. Example or explanation. For instance, the documentation requirements ensure that every process is traceable and every action is recorded. This makes internal and external audits easier. Another example, a company producing diagnostic devices must maintain calibration records, equipment logs, and complaint handling records. Foundation training ensures you understand these basics clearly. By mastering these concepts, you are ready to move to the internal auditor role, which is our next section. Internal auditor training. Internal auditor training teaches professionals how to plan, conduct, and report internal audits for ISO 13485. Key areas covered in internal auditor training. First, audit planning. Define scope, objectives, and schedule. Then, select processes and departments to audit. Second, audit execution. Interview staff, observe processes and operations, review documents and records. Third, identifying non-conformities. Spot deviations from standard requirements. Record findings accurately. Fourth, reporting and corrective actions. Write audit reports, recommended corrective actions, follow up to ensure compliance. Fifth, follow up audits. Verify that corrective actions are implemented. Ensure continuous improvement. Example, imagine auditing a medical device production line. You check calibration records, production logs, and competent traceability. Any deviation is recorded as a non-conformity and corrective action ensures compliance is restored. Internal auditing is the heart of a quality management system, and mastering this role prepares you to become a lead auditor. Now, next, lead auditor training. Lead auditor training is for professionals responsible for leading audits, evaluating compliance, and guiding audit teams. Topic, Topics include first, audit leadership, coordinating team members, assigning tasks during audits. Second, advanced audit techniques, risk-based auditing, process evaluation. Third, audit reporting, writing detailed reports for management review, presenting findings clearly. Fourth, stakeholder communication, reporting to management or regulatory authorities, explaining audit findings professionally. Fifth, continuous improvement, using audits to drive organizational excellence, corrective and preventive actions. Example, as a lead auditor, you ensure that the organization is not only compliant but also continuously improving. You supervise other auditors, guide audit observations, and report findings to top management. Pro tip, leadership, observation, and understanding the standard deeply are key to being an effective lead auditor. To summarize, in this session we covered an overview of ISO 13485 2016, key points of foundation training, how to conduct internal audits, leading audits as a lead auditor. Following these guidelines ensures that quality, compliance, and patient safety are maintained in medical device processes. If you are interested in professional ISO 13485 trainings, you can contact URGS International Certification and Inspection Private Limited, email info@urgsiso.com, mobile +91 7359458455. Do not forget to like this video, share it with others, and subscribe to our channel for more training sessions. Thank you.